I am pleased to announce that we will introduce a new Home Caregiving Grant, or HCG for short, by end of 2019. The HCG will be means-tested and available to care recipients with permanent, moderate disability regardless of age, and granted on criteria which is similar to what we now use for the FDW grant. The HCG can be used to offset the cost of long-term caregiving in the community. The HCG will complement severe disability schemes like ElderShield and CareShield Life by providing support earlier and at a stage where care recipients are still able to perform these activities of daily living, albeit with some assistance. In other words, HCG will be available at an earlier and less severe stage of disability when compared to the criteria in disability schemes such as ElderShield or CareShield Life. The grant will replace the FDW grant with an enhanced quantum of $200 per month. Let me explain this. I have said earlier that no two caregivers' journey is similar. Indeed, there are very many differences in the journey and also in the way in which care is expected to be delivered. We have noted Mr. Christopher D'Souza and Ms. Tin Pei Ling's point that care arrangements may vary from person to person, or indeed may even vary depending on which stage of care the recipient might be in. We want to be able to provide financial support which will better meet the range of diverse caregiving needs. At present, the current FDW grant can only be used to offset the cost of hiring an FDW. It is therefore limited because not all caregivers might need or want an FDW. So we will replace this with a HCG of $200 per month, which is an increase on the present $120 per month for the FDWG, and also allow caregivers greater flexibility on how they choose to use this fund. Some might use it to help with the cost of hiring an FDW, if that's what's needed, whilst others could choose to use this sum to defray the cost of caregiving expenses, such as the cost for home and community-based services and transportation to medical appointments. There is much greater flexibility in how this grant can be used, and care recipients who qualify can choose to nominate their caregiver to receive the HCG. Ms. Joan Pereira has also suggested that we broaden the definition of family members in government policies to strengthen familial support. On that score, we agree that family caregivers, first of all, they are usually the first port of call, and fundamentally in the entire ecosystem, they are key to supporting our seniors age in place. So we will allow caregivers to use their MediSave to help pay for the healthcare expenses of their Singaporean siblings by the end of 2019. These measures will complement our existing suite of long-term care financing measures supporting family caregivers, so they come on top of those measures.